Hi there. December 2017 saw the introduction of the renewed cervical screening program in Australia and the release of the associated updated cervical screening guidelines. This has presented some management challenge to clinicians as we all try to adjust to the updated guidelines and the change in management. What we're going to do today is aim to discuss some of the more commonly encountered clinical challenges to try and assist us in making sure that we're providing the right test at the right time to our patients with appropriate follow-up in place. All of the cases discussed today and the information are taken directly from the updated guidelines, which can be found at the website shown on the screen now. So the first case that we're going to discuss today is that of a young woman under the age of 25. This has probably been one of the more difficult areas of the new program as the shift in age of commencement of screening has moved to 25. So our first case today is a 24-year-old who attends for a cervical screening test following her last normal Pap test being performed under the old program 2 years ago. Her past Pap test was normal, she's asymptomatic, and she has an unremarkable medical history. So it's important that we understand the reasoning why we are moving the age to start screening to 25. If we understand the behaviour of human papillomavirus and the epidemiology of development of cervical cancer, then we can very confidently understand why we are commencing screening at age 25. We know that 99.7% of cancers of the cervix are related to human papillomavirus infection. We know that human papillomavirus infection is very, very common in young women within the first few years following sexual debut. We know that the majority of young women will clear these infections on their own within 1 to 2 years. So we don't want to be screening these young women and identifying all of these early HPV infections and then leading to over-investigation and over-treatment of these women. We know with our understanding of the development of cervical cancer that it is the persistent HPV infections that are the cause for concern. So we know that on average it takes about 10 years to develop from human papillomavirus infection to persisting infection to development of cervical cancer. So our screening test is designed to identify those persisting infections. Cervical cancer is a very rare disease in a woman under 25, and a population-based screening program is not designed to detect those cancers. There's good evidence that screening women under the age of 25 does nothing to reduce that woman's risk of developing an invasive cervical cancer before age 30. Head-to-head, our modelling has shown that compared to cytology screening at age 20, performing HPV DNA testing from age 25 does in fact reduce the prevalence and incidence of cervical cancer by about 15%. Okay. You will see on the screen now that there are some situations where it is worth considering offering testing in women under age 25. These scenarios include symptomatic women. So if a woman of any age presents with symptoms of abnormal bleeding, which includes post-coital bleeding that's persistent or unexplained intermenstrual bleeding, she should be offered co-testing. If there has been sexual activity prior to age 14, for example, in the case of childhood sexual abuse, a woman can be considered for testing between age 20 to 24. If a woman is sexually active and has been immunodeficient for more than 5 years, or importantly, if a woman under 25 is still to complete follow-up testing following a previous abnormality under the old program, she should be offered follow-up testing as per the new guidelines. So for our case today of our 24-year-old who has presented for a cervical screening test 2 years following a previous test under the old program, we can reassure her if she's asymptomatic and she's a healthy woman, that she does not need a cervical screening test until age 25. We can consider other opportunistic things in that consultation, such as STI testing, which is important. We know that as the National Register is phased in and as new functions are added over the coming months to the register, that eventually we anticipate that these women under 25 who would have been due for testing under the old program will receive a letter from the register explaining the rationale for shifting the age of testing to 25, and that is when their next test would be due. That function is not yet active under the register, but that will be one of the future functions that we anticipate to be phased in. In the meantime, it's important that practices just consider the recalls that may be in place under the old program for women under the age of 25 who may actually not have a cervical screening test yet indicated.